preventing infections in your baby and also spotting them. My name is Dr. Carly, also known as Professor Caroline Vertelman, and I have over 30 years of experience working with babies in the NHS, and I see many babies, and have done over the years, who've had very serious infections. Babies have a particularly immature immune system, and so they're very susceptible to an infection that you or I, or even children older than them, may manage very easily, a small flu or a cough or a cold, and they get really quite unwell from it. So I think there's one way to think about preventing it is using the THANK acronym, which is think hands and no kisses. So anyone who's handling your baby or touching your baby, they need to wash their hands properly, and there's lots of videos about how to spend enough time washing your hands. And no kisses. The only people who should be really kissing your baby is you, the parent, mum or dad, and the main carer, or the main carers. So we don't want lots of people leaning in, kissing your baby. And anyone who is touching your baby, they need to wash their hands. So that's thanks. Think hands and no kisses. In terms of spotting infections in babies, there's a number of things to think about. Do they have a temperature below 36 degrees or above 38 degrees? So it's very important you buy a thermometer, a proper reading thermometer that gives you accurate temperature for your baby. Is your baby lethargic? Are they listless? Are they inconsolable, crying a lot and you can't console them? Do they have irregular breathing? Are they sucking in? They might be sucking in here or sucking in their ribs. Maybe they're not feeding very well. Maybe they're not passing enough urine. They should be having at least 2 to 3 wet nappies in a 24-hour period. Are they not feeding as well? They're sort of completing less than half their normal feeds. Maybe they have diarrhea and vomiting. So excuse me, all of these are reasons to be thinking about whether your baby might be unwell. Additional ones are whether they might have some blisters or some rashes. Particularly look around the eyes, in the mouth, in the genital area. I think it's also worth looking under the armpits and in the hairline, as those are more difficult to spot places to find rashes. Excuse me. So these are sort of signs of infection, and it depends on how serious you think it is, and you can look at the baby app to decide how urgent you need advice. You can phone for advice on 111. You can speak to your midwife, your GP, your health visitor, and if you're really concerned, then take your baby to the emergency department. It is why we have emergencies departments, so that they can see babies with infections, particularly for worried parents. The other thing to tell healthcare professionals is when you were pregnant, did you have any sexually transmitted diseases? Did you have group B strep detected towards the end of the pregnancy? Have you had any new sexual partners, particularly in the last trimester? Did you have all your vaccinations? Did you have your COVID, your flu, and all the other vaccinations that are on offer? So, and the other question is, have you been abroad? So all this information, it's really helpful to give a healthcare professional. And also, if someone has been in contact with your baby who's either got a cold sore or has chicken pox. So these are things that healthcare professionals need to know if you're worried that your baby might have an infection, and this helps them try and work out what that infection may be. There's lots of ways of treating children with infections. Some are supportive and some might be intravenous antibiotics or oral antibiotics. It depends where the infection is and what it is. That's for healthcare professionals to help manage with you as you know your baby best. I think the bottom line is, you have to trust your instincts. You know your baby best, and if you think your baby is unwell, has an infection, is lethargic, not quite themselves, and you really cannot pinpoint that they're not dirty and they're not tired and they're not hungry, etc., then you need to take them to a healthcare professional to check them out, to find out what is wrong with them, because it's really important that they get treated urgently and properly for whatever infection they may have. If you found this video useful, please like and subscribe to my YouTube channel and tell other people about it.